This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Someone has said, well, after we've done an embryo transfer, why don't we make you lie down so the embryo has a chance to implant? Well, people have experimented with that, and the evidence is that makes absolutely no difference whatsoever to pregnancy rates. Resting has made no difference. And if you think about it, the uterus is not a balloon. I mean, we sort of imagine the uterus as a balloon. Once you're pregnant, it becomes a balloon. But in life, the front wall and the back wall are actually very closely opposed to each other. They're right up against each other. They're like the sheets on a bed. And what we're doing is putting the embryo between the sheet. People have done experiments putting radio opaque, X-ray visible dots of fluid into a woman's uterus and sees what happens. They don't fall out, and that's not resting. So first of all, there have been studies keeping women in bed, which made the hospitals richer because you're paying for their bed, comparing it with getting straight up and out, and it makes no difference to the pregnancy rate. So there is no need to lie down, be normal after you've had your transfer. It's not going to fall out. Even having intercourse on that evening may be a positive rather than a negative, in terms of you might worry that it's going to dislodge the pregnancy. It doesn't. And there is some evidence from animals that the seminal fluid may have a positive effect on the immunology of the acceptance of the embryo. So I actually tell my patients it's fine to have intercourse that night. No point in resting. I've been doing IVF for 37 years. And so I've had a fair idea about all the things that can happen, can go wrong, and kept in touch with the latest things that are going on. But I still think from a patient's perspective, education is number one. You've got to know what's going on. It's a complex process. The good clinics educate patients very, very well. And so it's my sort of role in life to some extent these days is to educate people. I've been doing it for medical students and young doctors for years. Now I'm hoping I can teach a little bit more to the patients that are out there.
Prof, we have a question from Amanda. She says, I've had some friends do a day 3 transfer and some do a day 5. What are the pros and cons for both?
We used to do day 3 transfers as a regular event. What happens in nature is that a group of day 3 embryos will not, a percentage of them will not get to day 5. Putting one back at day 3, we don't know really whether we've got a dud embryo or not. So success rates per cycle are less with day 3 embryos. So by growing them onto day 5, we're more certain that we've got an embryo that's going to take. So, for instance, in a 35-year-old, I'll be saying to a patient that in their first cycle, there's a 35 to 40% chance of being pregnant with a blastocyst. I would be saying 25% for day 3 embryo. You get more embryos frozen if you put them back on day 3 because we haven't grown them on and lost any of them. But those that we lost in the laboratory are ones that would have been lost in the uterus anyway. So I think it's about 80% of all transfers in Australia are now day 5 embryos. I know there are some clinics who still do day 3 embryo transfers. There is science that assists or that is required to grow them on to day 5. If the laboratory is not up to scratch, putting them back on day 3 is a way of getting around that to some extent. But I'm always a little suspicious if day 3's embryos are the same, are the standard in a clinic, because it may suggest the laboratory is not up to scratch. They also, day 3 embryo, people who do that on a regular basis also tend to put back 2 embryos to try and improve the pregnancy rate. But that ends up with more twins. And while twins sound wonderful, in fact, they have 4 times the risk of cerebral palsy because of prematurity and twice the risk of losing a baby than a singleton pregnancy. So now in Australia, again, we've changed over the last 15 years. We now, 90% of cycles in Australia are single embryo transfers at day 5. Science has moved on. Some clinics haven't moved on. They're the ones that are still doing day 3 transfers.
Prof, we have a question from Dushia. While taking hormone injections of 450, what is the best dietary while taking injections so high, like increasing eggs?
There's no evidence that diet makes any difference whatsoever to your dose or the impact of your dose. No, I mean, there's a lot talked about diet in social media and on Dr. Google, and the evidence is zero that anything in particular, other than a balanced diet, vegetables, meat, fish, makes any difference whatsoever. Vitamins, supplements, absolute garbage in terms of scientific evidence that they make any difference whatsoever. At 450, clearly your clinician is concerned that your ovaries are not responding very well. That's the highest dose that I go to. Some clinicians rarely are going as high as 600. I've heard of even 900. But the truth is the body doesn't actually deal with it. It just puts it out in the urine. So those very high doses make no difference. And it may even be that 450 is making no difference compared with 300. There is some data suggesting that. But I still go to 450 when, you know, we're really trying to push those ovaries really as hard as we can. In terms of diet, nothing makes a difference.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey Podcast from the navigation menu.